My name is Dr. Hilda Nasibwa. I'm an internal medicine physician and a diabetologist, and currently also going through endocrinology. And I am the head of research at Mwai Kibaki Hospital, which is in Othaya, Kenya. When I attend these big international conferences, I always see that studies are being presented that have been done on 10 people, 20 people, 50 people. And I realize that we complicate these things too much, that research is not as complicated as we think it is. It is something that we can do. It doesn't matter whether it's a research assistant or a professor, anyone can be part of research. To be honest, I had done my thesis. I had a bit of experience with the research before, but I felt like it wasn't to the level that I wanted it to be to make me create a big impact at the place where I was working. And so I decided to take the ECORM training by Health Data Acumen so that it could help me understand research better and then know how I can apply the knowledge that I had to the patients that I had in the field. Because I realized that we had a lot of data at the field, but I didn't know how to interpret this data or make it formal into a paper that other people could actually understand. One of the things that are different about the ECORM training is that it's very hands-on, as opposed to some other types of training where you are taught and then you have very little practical application of the knowledge. Here we actually have a step-by-step process by which we actually have to do these things by ourselves. So I find myself being better at practically doing research than I was before. I honestly think it's going to impact the way I work. It has already impacted the way I analyze the data that I am given, because unlike before where I would just get a paper and accept what I was being given, now I actually go into detail. I actually question the science behind the data that I am given. And I think that has been very important to me because I don't just regurgitate things that I see. I actually now do more analysis. And at the workplace, because now I was given a docket in the research department, it has made me more aware of certain structures that are in place when it comes to research that I have to ensure that my department has, because ours is a very new department. So it has made me more knowledgeable about how to structure my department, how to ensure that we get the best out of the people who are working there, and also how to create better studies that are going to impact the world positively. Another way in which the ECORM training has helped me is I have an online platform known as Diabetes Doctor, where I educate healthcare workers and even patients on matters diabetes, how to live with diabetes, how to treat diabetes, how to diagnose it. And to me, it's very important to have the right information out there. And so the ECORM training has also helped me because I research for the best ways in which I can get the best information that is legitimate and that the science is, concrete. And so I would just like to ask people to take the first step. Once you take the first step, enroll in the ECORM training because it will give you that confidence that you need to realize that you have it all within yourself. And after that, we'll be able to now do more research and get Africa out of the darkness when it comes to matters research.